Faced with the possibility of another COVID-19 surge stemming from parties and travel over the winter holiday season, Los Angeles County health officials are urging workers and students to wear masks in indoor public settings for at least 10 days once they return to work and school. Wearing masks for this duration could help blunt another possible wave following New Year's Day, officials say. "10 days is the rough incubation period for the coronavirus, the time between when someone is exposed and when they might be contagious, even if they don't develop symptoms themselves. The holiday season by its very nature brings increased risk of exposure, including at celebrations and events, due." County Public Health Director Barbara Ferrer said Thursday. "With transmission levels still high, there is a good likelihood many more people have been exposed." Masking, which remains recommended but not required in indoor public settings in L County, can help interrupt the cycle of transmission, many experts say. Individual work sites, venues and other settings can set their own requirements if they so choose. A statewide mask order remains in effect in healthcare settings and nursing homes. California workplace safety rules also require workers to mask up if they've been in close contact with an infected person for 10 days after the exposure. School systems in L County have not followed the path being pursued by their counterparts in Philadelphia, where the school district plans an indoor mask order for students and staff for the first 8 days of school after winter break. L County health officials are, for the moment, expressing relative optimism about recent coronavirus trends. Case rates are continuing to decline following a Thanksgiving surge, and coronavirus levels in wastewater are also dropping as well, downturns that have greatly diminished the likelihood of a universal indoor mask mandate returning this winter. Still, as has been proven time and again in the COVID-19 era, the nation's most populous county does not exist in a vacuum. Developments and trends elsewhere have a way of making themselves felt locally one way or another. The pandemic's previous waves have often coincided with the rise of a newer problematic version of the coronavirus, as happened last fall and winter with the arrival of the Omicron variant and the previous summer, when Delta fueled a surge in cases and hospitalizations. This year has been defined by different subvariants of Omicron jockeying for nationwide supremacy. In recent months, the long-dominant BA.5 gave way to two of its own descendants, BQ.